When I first started working here, we didn't have pig's feet. We had these suture arms, and they're rubber. But the bummer is that they, when students are learning, they tend to get kind of rough with them and they rip. My name is Michelle Kennedy, and I'm a women's health nurse practitioner here at Search. I teach in the community health aid program. I'm one of the educators. Really happy, because sometimes a health aide may be the only provider in their village. There may only be one, and that's them, and they're really responsible. And they're on call 24/7 unless they have a locums come and give them some time away, but pretty much it's all about them knowing what to do. And we have a whole set of textbooks they use called the CHAM, it's Community Health Aid Manual, and it's wonderful because it's like cookbook medicine, and everything they need to know is in that book, and they don't need to know anything by heart because it's all right there for them. So yeah, that's awesome stuff. It's really a great program, and Alaska's pretty unique in having it. In high school, if they have an opportunity to take some science classes, biology and chemistry is good, especially if they want to continue going further. But biology, if they have any anatomy class, that's always a good thing. Knowing how to read is a really positive thing for sure. But yeah, those kinds of things, the sciences, I think are the most helpful. And then if they get into college and they decide, well, I'm not quite ready for that yet, but I need to work, then if they've taken some preliminary things in college, the sciences basically, and some medical terminology, that's very helpful to them too. You have to be able to have compassion. That's big. And you have to know how to talk to people so that they understand. And sometimes that's a level that isn't quite where you expected to speak. You have to speak what the people speak, whatever that is. And if you can make yourself understood, I think you can be really successful. But some people, you know, if you speak medical jargon and that's all you speak, well, after a while they may get it, but initially they're going to not. And they might feel badly about themselves because they thought they should understand, and they don't. So even with patients, after someone who has more education than myself has spoken to them, and I see their face, and I'll say, so did you understand what was just told to you? No. Okay. So then, you know, I translate it. So I think that's a huge piece. The other thing I think that's really big is healing. Being able to heal people, you know, and that's something as maybe as insignificant as giving them a warm washcloth to wipe their face in the morning. I'm an old nurse, so I know old nurse stuff.